Good morning. Hello. Welcome, everyone. Today's February 25th, 2025. I'm Karen Holtz. I'll be your moderator today. This is our Georgia Flex Health Equity Improvement Project meeting. I put a link to the slides in the chat, and I'll try to do that throughout the session as people join. So welcome, everyone. Our agenda today includes a quick Oops, I lost my slides. Hang on. Oops. Okay. Quick review of the data validation and SDOH maps that we have. This is a fun part of when you're moving from data collection into data analysis. Make sure you're collecting what truly reflects the population in your community. So I have a quick example there. And then we'll have a breakout session today on domain 2. This is the data collection, the 2A, 2B, 2C. It was a homework assignment. I have 10 hospitals already responded, so that's great. We'll go into breakout sessions. And then I have a few slides on the data analysis. This is really the heart and soul of our work. And we have to make sure we're stratifying. So we'll talk about that, project timeline updates, and we have resources and other webinars for you as well to share. And please ask questions as we go along. As always, you can reach out to myself or Mel Brown for any assistance. We'd love to hear from you all. I wanted to mention the Health Equity Improvement Project Playbook. And this is your health equity strategic plans. So this is on our website. Please make sure you can reference it quickly. We're going to go back and look at your goals, your action steps, and we're going to start reporting out this year around the data analysis. So this is the domain 1 that Rosa walked you through. Very important. And it really showcases your strategies, your community partners, your populations, your population 1, your priority population 2. So if it changed, that's okay. If it stays the same, that's great. We're going to move forward and we're going to start stratifying your data. Just real recap on this is domain 1, as I mentioned, and that's in your playbook or your health equity plans. When you attest this year, you should all attest yes for domain 1. It is mandatory reporting April 1st to May 15th. So you should all be attesting yes to domain 1. And today, like I mentioned, we're going to move from domain 2, data collection, into data analysis. And this is, like I said, a very heavy lift for some, and Mel and I are here to help you. Domain 2, the 2A, 2B, 2C, are you collecting the demographic information, SDOH, your real data? Do you have training for your staff? And we're going to talk about this in our breakout sessions today. And then are you inputting it into your electronic health records? So, so far, that have replied are doing very well. So this is going to be a good report out session. And thank you all for signing in. Thank Kayla, Caitlin, Dexter. Thank you. The core measure set that you're responsible for reporting, there are 2 measures here. SDOH 1 is your screening. SDOH 2 is your screen positive rate. So we would love for you to report this for your 2024 data collection. If you have it, you can enter it again this April 1st to May 15th reporting period. It is not mandatory until next year. And as we mentioned last time, you validate your data before you move to data analysis. We talked about the community health needs assessment last month, county health rankings, United States Census. And I looked in the playbook, so I see that many of you have already looked. You have your data. You know your percentages, you know your screen rate, your screen positive rate. So this is really good. You're ahead of the game. Another fun way, if somebody's really stuck, Alliant has a data map that we can look at transportation, we can look at food insecurity by zip code. And I'm going to see, I know the next slide, Joni Powell was going to unmute. Let me see if she's on the line. But anyway, we have these maps. This gives a score. This is for food insecurity, a score that does not display percentage of people with an X condition. It's a higher score. Dark orange areas represent higher disparities. So the source is this Food Insecurity USDA Food Environment Atlas. The link is there. This is last updated in September 2020, but it's just a way to validate. You can see here the state of Georgia and the areas in the dark orange with the highest scores. So they have the food insecurity. I actually just picked one. I selected one, Jeff Davis Hospital. I don't know. Karen R., do you see?
Joni's on. This is Linda. I see her on the list.
Oh, okay. Joni, you can unmute if you'd like to mention what you're doing on your goals.
Yes, can you hear me?
Yeah.
Hi, Joni. How are you? We sure can.
Okay, great. Thank you so much. Good morning. My name is Joni Powell. I'm with Jeff Davis Hospital. I'm the case manager. I want to thank you for the opportunity for giving us to allow us to discuss what Jeff Davis Hospital is doing with the social determinants of health. Food insecurities was one of the things that we chose. Our goals was to work with our hospital vision, which is building a healthy community. One of those things that we've seen was food insecurity. So as a team, we looked at the needs of our community, and then we kind of built goals to how we could actually, what we needed to look at with those insecurities. The first goal was to increase availability to food for the citizens in need for our community. Number two was provide education to the community on healthy eating and healthy living in hopes to decrease obesity, since we do have a large number of obese patients in this area. And then we focused on actions, what we could do to actually implement and reach our goals. The first thing was free produce with drive-through farmers market. We had a total of 3 drive-throughs this year so far, which fed 1,500 families. Feeding America Food Bank. This is something that's still in the process of being in the build phase. However, we are funding Good Grounds Food Bank, which is a community food bank. It's going to help provide food for those in need, but also Employment Resource Center is going to serve as a resource center to help people get back on their feet, find jobs. And number 3, which was the Shop and Save, which is going to go with the food bank. It's going to be a 24/7 food bank for the community. And then 4 is case management. We provide resources to patients and to people in the community. When they have questions, we try to educate and provide assistance, whether it be pretty much any resource, but food is a big one. And then also hospital nutritionist, Ms. Pam, she provides education and healthy wellness classes. We have a Loopstream TV monitor that actually is in waiting areas, providing information on healthy eating and healthy living. Again, this is all tied to our hospital vision, which is building a healthy community.
Thank you, Joni.
You're
Excellent.
welcome.
Any questions for Joni? On the left, you see there what I pulled out of the Alliant maps by zip code. I can see her county there. The food insecurity score was 5.39. So, and then you can see the 4 levels off to the left in the different shades of that orange. So definitely a need in your community. What types of food do you offer through the drive-through?
We try to do fresh produce, nuts, things that are healthy, but they also have meat. It's been poultry that we've used in the past 3.
Oh, wow. Okay.
Joni,
How do you,
I was going to say, Karen, Mel Brown's excited because she's close to that area. And this probably does your heart good, Mel, to see this.
It does, Joni. I was actually in Hazelhurst Sunday evening, doing a trade off with my grandpups and her mother. And I think that I would ask, so everybody was had a lot of damage with the hurricane that came through. Have you seen an uptick in some of the going through the drive-throughs and everything? Because your area was truly devastated during the hurricane. And I know that y'all are still coming out of that. So, has that had an impact on this at all, or could you tell?
We could, certainly during the hurricane, there was a lot of people affected with the electricity outage, and we really worked with the local churches. They really stepped in and helped the community, and we kind of worked with them to make sure that people got fed, and if they need anything, we tried to support each other as pretty much as a community.
And I would think some of that probably is ongoing because y'all look a lot better than you did a few months ago. You still have a long way to go in some areas. So good
Yes,
job.
ma'am. Well, thank you so
Really
much.
good job.
great job. Thank you, Joni. I think you work with Bonnie, right, as well?
Yes, ma'am.
Very good. So my challenge to Jeff Davis is, are you linking this to diabetes, any performance indicator? Keep track of your data. You said 1,500 families. So is that total? Just keep tracking of your data. Are you linking it to any clinical performance indicators, readmissions, diabetes?
Well, with the loop recording for the TVs, that pretty much goes with healthy living and diabetes education and diet education. With the food banks, it's such a large turnout, and it's hard to capture that information with the drive-through. Now, when we actually get with the food bank actually opens up, I think it'd be more grounds to kind of ask questions and get more data that way. But with like the drive-through, it's just such an influx of people in such a short space. We try to keep it moving so it doesn't congest the area.
And
Very
Karen, I
good.
would add to that, in addition to diabetes, Johnny, this might be a good time to begin to wrap y'all's mind around, in addition to diabetes, hypertension, because we know the state of Georgia has consistently had higher rates for hypertension. So you mentioned, healthy living and wanting to decrease obesity as well. So, all of that plays hand in hand. And here again, we're just trying to give you the opportunity to look outside of just the collection and just some thoughts on how to, bring other things in that you're probably looking at. So diabetes, hypertension, and Karen mentioned readmissions. Though you might not see a big impact in the beginning, you can begin to tie some back, especially, once you have a way, as you said, with the food banks of, kind of having an idea of who's utilizing those services. So a great way to tie many things in that you're doing and not have to duplicate or feel like you're duplicating a lot of things.
Very good. Linda just put a note, stamped postcard, or you get feedback every 20th car or something. So it's great. I love to hear about the drive-throughs and farmer markets. So all good. Very good. Thank you, Joni.
Thank you.
Oh, I'm sorry, did you want to any?
Oh, no, ma'am. I just said thank you.
Well, you're welcome. You're welcome. Pleasure working with you. Thank you. And Nicole, I just put the link into the playbook. I apologize. The link in the slide deck, it had to be modified. So we do have the new link to the playbook. So that will go in our post-event email. It should have been in the pre-event email as well. So I'm going to reference those. Okay, so Karen R. and Hannah are going to put us into breakout rooms. So we need a polling question first. Are you responsible for submitting the attestation information into the hospital quality reporting HQR system. So only one hospital, if you just want to check. Are you responsible for submitting it, or is it someone else? We were just curious. And it may be a 50-50 split. So we just want to get your answers here. Okay, Hannah, you want to close that out? Someone else is. Okay, 65 to 35. Okay, that's good. I just wanted to know, as we go into this breakout session, we're going to go through these questions. This is your chance, peer-to-peer networking. Let's talk to each other. What are some of your examples? And then we'll do a debrief. Facilitators or the hospitals can report out. Linda, Mel, and I are certainly want to just report out. What did we learn? What were any challenges? And thank you all. This is the homework assignment, the survey. And I have here the 5 hospitals who completed as of the 18th, but I looked yesterday and there were 10. So it looks like I have Putnam, I have Optum, Medical Center Tatnall, Atrium Health, Navicent Peach, Warm Springs, and Rebecca, Albert Memorial. And that was Kelly Smith. I have Mountain Lakes, Cynthia, Morgan Medical, Caitlin. Let's see, Bacon County, Jenny Johnson, Chatouche, Regional Hospital in Dexter, and Miller County, Ashley. So great work. I have your responses. And so if you're on the call, we're going to go into breakout rooms and we're just going to discuss this so hopefully others can learn. And so give us 15 minutes, Hannah, if you want to put us in breakout rooms.
Okay, off you go. And we're at the main session if you need any assistance. Also in chat.
Okay, thank you. Okay, we're all back. I was in the middle of talking, but that's okay. We this was really good. Let me just Linda and Mel, are you both back?
We're back, and it was really good.
It was.
Yes.
Great sharing. Great sharing.
Mhm.
Let me see. Karen R., I lost my ability to move slides coming out of the breakout room. Just to let
Can
you
you
know.
do it?
Coming
Oh,
right.
I got it now. Thank you. All right. We're going to have a report out. I've got 10 minutes for the next 10 minutes. Let's just have a report out. What did you learn? Any barriers? So I'll start if you want me to start with breakout number 1. And let's see. I tried to capture all these names. Wait, Rebecca Bishop from Warm Springs, Nicole from Effingham, Caitlin from Morgan Medical. I had Dawn and Amanda from the State Office of Rural Health. Melissa. I'm not sure if I had Ashley Ward. Did I have Ashley or not? But anyway, so we had a good group and we went through 2A, 2B, 2C, and just a lot of these hospitals are using that Prepare tool and built into their Cerner, and just some challenges when someone's screened positive and case management wants to print out the resources and ask, do you need assistance or would you like some information? Some patients said no, that was an error. No, maybe I misunderstood the question. I don't need any housing instability, resources. So I don't know how that affects the data because it's already in the system as a yes, it's screened positive. But so there are some challenges with documentation and misunderstanding the question. Maybe collecting that real data. Caitlin Gibson from Morgan Medical Center, she's going to go back. She's did the PDSA cycle on collecting this data, providing the training, researching, providing her training, had her nurse manager help her. But she wants to go back and improve on the real data collection. So she's working on her PDSA cycle. And you can certainly put that in. We're going to go into action planning and reporting out. Caitlin, that's something you're working on. So please report that out. So, and others can learn from you. And the last kind of lesson learned was hospitals are now going into a new community health needs assessment timeframe, right? After 3 years, they're gearing up, and so their strategic plans from last spring will change. So that's good too. It's again that continuous improvement, validating your data before you go into your data analysis. So that's an important point if you have a new community health needs assessment ongoing or active. Okay, I'll turn it over to Mel. You were in breakout 2.
I was, and thankfully Jenny is going to report out for us. But I will say, Jenny, we did have folks from all around and along South Georgia, over Southeast Georgia, Middle Georgia, above Middle Georgia, and up in the North Georgia mountains bordering on North Carolina. So Jenny, if you'll hit the high points for us, and then if you need me, well, I'll come in and fill in. But we had a great group, lots of good discussion.
Yes, ma'am. In the 4 that commented for us, we had Scarlett from SGMC, and they're using Epic as their EMR. And they have identified that they have 2 counties within 15 minutes apart. They've identified their priority in need was primary care physicians, food, and transportation. They have 2 different age groups. They have an older group and then a younger group because they're tying it back, to my understanding, to kids that have a better school system or maybe a more resources available to their school for the younger kids. And then Dexter shared that they're using the Prepare tool, and on discharge, they're giving a handbook and also providing the patients with a provider resource list. They too recognize that food was one of their main deficiencies in their area. And then Jasper, she replied that most of her patients in their area were okay right now because they have a very involved food bank. They're very blessed with that, and wasn't having a lot of need in the community because of that. And then we lastly in Bacon County have identified food, housing, and transportation as our top 3 using the CMS questions that is built into our EMR, which is Meditech. So we are in the process of beginning our China assessment. We went to the State Office Rule of Health and combining that information as well and moving forward with this project.
Thanks, Jenny. And so, Karen, something that we can discuss, Scarlett did bring up a good opportunity thinking about school system. And as I told them, this was the first time that I had really, thought about that and made that connection. So that was a good lesson learned. And then the other thing with Dexter sharing was, that not only is he serving Georgia, but you have those folks coming in from North Carolina as well. So you have to look at that. And, Scarlett, you didn't mention that, but y'all may see that a little bit down in South Georgia too. So, a lot of good information. Food insecurity, definitely. A little bit of transportation and housing. But anyway, it seems like food insecurity keeps bubbling up to the top. But great job that all of you are doing in Group 1, Group 2, and we'll hear from Group 3 with, really making those linkages with the food banks and the availability in your communities. It sounds like that's being stepped up all over the place. So thanks, Karen. And thanks, Jenny, for reporting out for us. I greatly appreciate that.
Okay, group number 3, not to be last, but let me just say I wasn't smart enough with this group to say, does anybody want to report out? So I took notes as you were sharing, and I'll do the report out. But we had Joni in our group, and we thanked her for giving us that time on that slide for the Hazelhurst area. And those of you, we love it when we hear from folks. So I know Karen's always reaching out, give us a moment of your time to share, and that was a great report out. And then, I just wanted folks to introduce myself, and I just had to say we had so many people that had names that were not around in the 50s when I was named. I have to just say there was a lot of discussion about that. But let me just share that LaShawna from Navicent and Angie both shared a little bit about the Atrium and Navicent system and how they don't, well, for example, LaShawn is a community liaison kind of a person. So no, she doesn't do the actual reporting. Remember when we just did that polling on do you do the actual reporting? It's their quality department that does that. But it pulls from their EHR system, which is Epic. And they give input to their team in the quality department. And then they using, the EHR, plus there's maybe more information in my chart that they're able to find out and to share within which is the portal system that the patients at the Atrium facilities use. Kayla from Monroe shared that she uses an SDOH questionnaire to find out information that's needed, and they enter it into their system, which is called CTSI, and it may not be the most up-to-date system, but it's able to be populated. And then she shared that this falls on the case manager, for example, herself, and then the patient access staff that get people at admission. So it's kind of I guess if you flow charted this is kind of it may not be as seamless as some of the other systems. So there's some handoffs that have to happen for that data to get reported there. And so it's good to hear that and to hear how that's flowing. Lynn and Courtney both shared that they haven't started their homework yet. And I made a comment that I thought it was due in early March, but I'm looking at this slide, Karen, and it's not due till March 31st. So folks have a few more weeks to get that entered in, but they use the Prepare tool. That's a validated tool.
Right.
They use that at admission, which is a great tool. And then they're also tied into the staff that provide a community resource list that has tailored specific resources for their local community that they can put in the hands of the patient around their needs, which is lovely. And then we had a visitor in our group, and I love it when we invite visitors. We got somebody from Texas and Louisiana last time, so we had a visitor, which was Kayla Peoples, another Kayla, and I love that, who's in a nonprofit in Gwinnett County that helps people with their social needs in their county, and as a partner in their work in that area. She learns from us, and she thinks about how we do all things health equity to make sure that we're reaching people who are in need and reaching people in Gwinnett County. Certainly, while it's an urban area, it also has rural areas. And it, I think, if I remember correctly, has some red on that zip code map that you showed earlier, Karen, which is good. The other thing is we may want to invite Kayla Peoples to come back. She, in a previous position, worked on human trafficking. And, we mentioned, it is building a relationship with the patient when they come through the door to ask them questions about sensitive topics, about their food needs and their housing needs and transportation utilities. And those are things that have to have a certain amount of caring that is not filled with stigma, of course. And in doing that, people's safety is part of that. And human trafficking is something that Georgia, unfortunately, has a problem with. And so you're right, Snellville is considered that. And so thank you, Kayla. But thank you all for your participation today. I think we had a great sharing out in all these sessions. Karen, don't you?
Yes, thank you so much. And I'll type up some notes, and I send it out in the post-event email. So there's some, lessons learned, working on your PDSA cycle with training, with data collection. So that's great. School system, interesting. But school system, So, in my chart, looking into my chart, I know when I complete my chart questions, I put it all in there. So I was wondering if someone looked at my chart because it's all there. It's all there. Once you talk to the patient, you have that patient, and you're honing in on community resources or what they really need. So that's great. Great report out. Any other comments from the group? We're going to move on. Okay, so we have 12 minutes. Great job, everyone. Great job. I appreciate it. We're going to go into the data analysis. This, like I said, is the heart and soul, domain 3. You're going to show me your data analysis into the factors contributing to the health disparities and how you respond, and you attest to the following activities. Are you stratifying your data? So it's measure stratification. So you want to take readmissions and look at transportation issues to see if your readmissions drop and you get rid of that health disparity of transportation access issues. So this is a simple yes or no question, but it's very complicated, or I should say complex. And some of you may already be doing this, and that's what I want to start seeing. We're going to start reporting this out. Select your key performance outcome, such as 30-day readmissions. I was reading the playbook. Someone had respiratory readmissions for Black females, diabetes, hypertension. Mel mentioned hypertension and relating that to food insecurity. And if you don't know your key performance outcomes, what is currently on your hospital quality dashboard, and take one of those like readmissions and start breaking it down into race, ethnicity, language, transportation or other social determinants of health, drivers, food insecurity, transportation. And then you display the gaps in the dashboard, or any other way. You can put it in a brochure, but we want you to have it displayed. Show me the data that I can just look at and say, yes, you do have a health disparity. And then your interventions, what do you work on? So, and this is where your charts and graphs come into play. So it can be run charts over time, usually bar charts per ethnicity, per a group. You use your bar charts. So we're gonna move into the data analysis in the next couple of months. I looked at your priority populations. This is just population 1, and we looked at this slide months ago. But transportation, 7 hospitals said you're working on transportation. Again, align it with readmissions or something else. Another 7 hospitals said you're working on readmissions. Again, stratify that by your social determinants of health. Okay, Linda, Mel, and I thought about, it's your time to shine as we move forward. Hospital action plan sharing, and this is where I wanted you to look at your strategic plans in that playbook. I put the link in the chat, and I'm going to put it in the post-event email as well. But make sure you look at your domain 1B. This is your strategic plan, your goals, and your action steps. And you're going to report out. Everyone's going to report out in the next couple of months. I have a template for you, a PowerPoint template, and you can certainly add to it. You can attach your data analysis graphs. And I want you to select a date, and you can share with others and report out. So it's a simple PowerPoint. I wanted to make it easy for you. You can include your photo, your team photo, your hospital name, your name, and what is the goal you're working on right now. And it can be you're just starting. It could be you're in the middle of it and you have to go back and revise this goal. It could be that you're at the end of the goal and you implemented these action steps. What did you learn? So this is example 1, increase the availability of food to citizens in need. You offer the free produce. This is Joni Powell's example with the drive-through farmers market. It's ongoing. What are your performance outcomes? And we mentioned aligning it with readmissions, diabetes, hypertension. Start looking at those 2 to see if you're decreasing the hypertension in your patients. Lessons learned, avoid the backlog or the blocking in your hospital parking lot. Things like that. So how can you help others with your action plan, here's another example too: implement interventions for patients experience transportation access issues. You're collecting your monthly prepare. I did spell that wrong. It is prepare data and track the number of patients screened positive. Right, you're going to do this. And looks like Hannah put up, what date would you like to share? I'm going to follow up with you. So select one of these dates when you think you'll be ready to share this slide. Everyone should have that, collect that monthly, that data, whether you're analyzing it monthly, quarterly, annually from 2024. You should all have that data. And then what are you doing? And you put your action steps in there. So that's what we want to see. Okay, pick a date and I'm going to reach out to you in the next couple of weeks. If you're ready to go, you have the data analysis already for March 25th. That would be great. We do want to talk about data analysis. We have reports on how many hospitals actually attested so far, and what hospitals may need some additional assistance. We're here to help.
Sharon, I think this is going to be a good opportunity too from you all as you begin to share your information with us, and we share, on the different dates. You're reporting out the lessons learned, especially because who would have thought about, if you're bringing the food bank or the, opportunity to the hospital parking lot, it's only so big and it blocked things off. That was just one thing that had been shared, but that's a really important thing that helps you with your strategic planning going forward of, where do we actually do this and things like that. So we want to learn from you all as always.
Okay, Hannah, you want to close that poll? Yes.
I was going to share that, a couple of folks shared that they use a tool like the Prepare tool. And as people, with data collection, some of you probably have heard this at meetings about high reliability. If you ask, Dr. Reeser's information on that maybe had been presented at a meeting in Georgia, is if you ask the same question to 3 different people and they don't give you the same exact answer, all 3 of them, then you don't have a reliable process. So when you use a validation tool, a paper tool, or you have many people doing the work, they could be saying it different ways. I can tell you just me, I did it differently, probably than the way Karen did, even doing our little breakout room. So we don't, you want to make sure that you're collecting the same way and that your information is validated, and then move forward with making sure that you're trending and looking at it and finding out, digging deep into the data, playing sleuth, getting out your magnifying glass, putting on your cap. What did I say? I said it was
Sherlock Holmes.
Sherlock Holmes cap, but then Mel reminded me that there's more common detectives than Sherlock Holmes.
Okay. Thank you. We're going to wrap up project timeline. Anything you learned today, please communicate and share with the appropriate staff. There are available resources to validate the data if needed. Again, very important, and I think your community health needs assessment is going to help you very, very much. March 25th, we're having a learning session on the data analysis. We will discuss the MBQIP reports for the Georgia Flex hospitals that we have from the State Office of Rural Health. Discuss plans for technical assistance. How can we help you? What do you need? I'm happy to help with any charts and graphs. How can you display it? So that's, again, very important for domain 3, that you're displaying, show me the data. Complete that survey for those who haven't finished it by March 31st. We just want to make sure you fully understand domain 2 and you can attest to it in this reporting period. And then in April, we'll talk about the attestation and work group discussion of any hospital action plans. And if you signed up for March, we'll have you present in March. April, we'll have you present in April. Our website is located there, the Georgia Flex resources. The playbook is now there on the website, so it has been updated, and the playbook will be listed there in that blue area. Other resources, Linda shared this state fact sheets in Georgia. The link is listed there. So that was interesting, food insecurity. And it's a little bit more benchmarking if you want to get into the benchmarking, county by county, state by state. It's very interesting. This RQITA Resource Center is also available to you for more details on data submission. So any new folks who may need that. And Linda found this Building Resilient Leadership Teams in Rural Healthcare, February 27th. There's a link to register if anyone is interested in attending this Zoom webinar. I believe it's free, just registration required. Great, thank you all. I appreciate it, and thanks all for speaking up, learning from each other. So have a quality day.
Great participation. Thank you.
Thank you all.